Hi everyone, in this video I would like to explain about the CPC exam question paper pattern. Previously we have seen how the pattern will be, right? So in this video we will see real time CPC question paper pattern. So how to prepare for the CPC. So we'll start with the anatomy and medical terminology questions. So here are some questions to have an idea how the questions will be in the CPC exams. So glomerulonephritis is an inflammation affecting which system? So this is the question. So from this you need to pick one option which is the correct one. So how to pick that? Glomerulonephritis, it's nothing but an inflammation. So itis is nothing but the inflammation, right? So in which region the inflammation is, which system related? So immediately we need to pick. So digestive, nervous, urinary, cardiovascular. So glomeruli are the part of which system? Urinary, right? So like that you need to pick the correct answer. So it's related to the urinary system problem. So it is the inflammation of the filters of the glomeruli which are the part of the urinary system. So digestive, nervous, cardiovascular are nowhere related to this kind of disease. It is related to the urinary system. So my answer is urinary. So like that you need to pick the correct answer from the multiple choice questions. So we will see the next question. When a patient has fracture to elbow and physician performed a reduction on fracture, so what is the medical term for the reduction? So in this scenario, patient had a fracture to elbow. So after the fracture, what will happen is the fractured region might have been displaced. That means it has moved from one place to another. So in this condition, so what physician will do? He will treat the fracture. So he will reduce that fractured elbow into the normal position, right? So that reduction in the medical terminology what we will call, whether it is casting, manipulation, skeleton traction or external fixation. So from this option we need to give the correct multiple choice answer. So reduction, another name in the medical terminology is, it is not casting, it is not skeleton traction, and it is not external fixation, it is manipulation. So another word is manipulation. So like that you need to pick the correct answer from the multiple choice question. So we will see remaining questions. When a patient has fracture to proximal end of the humerus, so where is the fracture located? So proximal end of the humerus, patient had a fracture. So another term for the proximal region is, so from this option you need to choose the correct answer. So humerus comes under which region? Arm region or leg region? So in order to pick the answer correctly from the anatomical location, you can remove the remaining two options. So it comes under the upper arm region, right? So leg is not the correct answer. So B, C is not at all the correct one. So either it must be A or D. So proximal means, what is proximal? Which is near to the middle portion of the region. That means it is the upper end. Proximal means upper end, distal means lower end. So my answer is upper end of the arm. So like that you need to choose the correct answer. So in this way you need to pick the answer. So next we will see the remaining question. What does oligospermia means? So what is the oligospermia? It's a presence of blood in the semen, deficiency of sperm in the semen, having sperm in the urine, formation of spermatozoa. So my correct answer is, it's related to sperm deficiency. So the answer is deficiency of sperm in the semen. So like that you need to pick the answer. So the correct answer is, oligospermia is nothing but deficiency of sperm in the semen. So next we will see another question. Thoracocentesis is removing fluid from which region? So physician will do some surgeries to know the diagnostic condition. So one of that is thoracocentesis. It's nothing but the fluid removal that, like pleural effusion to treat that condition. So they will remove the fluid from different organs. So thoracocentesis, so to which region they will conduct this surgery? So it is lung, chest cavity, thoracic vertebrae or heart. It is nothing but lung. So the physician will perform the thoracocentesis in order to know the diagnostic condition or to treat a condition. So he will remove the fluid from the lungs. So from this option you need to select the correct answer, and the answer is lung. So like that we need to choose the correct answer from the multiple choice questions. So these are some pattern type questions which are based on the anatomy and medical terminology. We will see remaining questions in the next session. If you have any queries, please comment below.